All right, so as our last few registrants trickle in, I'll go ahead and start off by introducing our topic and introducing our presenting collaboration. So this webinar series is a collaboration between the University of Melbourne Centre for Digital Transformation of Health and AIDH, the Australasian Institute of Digital Health. And it's been a very exciting project so far. And probably most of the registrants were here before the Christmas holiday when we presented some findings, evidence from the literature, and introduced folks to our survey. And the purpose of this webinar is a follow-up where we are going to give some descriptive outcomes and results from what we found out in that survey. But before we dive into our topic, on the next slide, I will just acknowledge the traditional owners and custodians of the unceded lands on which the University of Melbourne uh, is and where we work and live, the Wurundjeri, Woiwurrung, and Bunurong peoples. And I want to pay my respects and our respects to elders past, present, and future, and acknowledge the importance of Indigenous knowledge to the Academy and to all kinds of technologies. And I will start by introducing myself and allow my colleagues to introduce themselves as well. My name is Portia Cornell. I am a senior research fellow and a health economist in the Center for Digital Transformation of Health, and I am also in the Center for Health Policy. And I will, Carol, you can introduce yourself, and then we'll pass it to Debbie.
Yes, thank you very much, Portia. Good afternoon, everyone. For those who are already in the afternoon, still good morning for a few of you. So I'm Carol Kenny Sarasa. I'm the Senior Policy Advisor at AIDH. And I would like, before passing on to Debbie, I just would like to acknowledge that this project is funded under the Health Peak and Advisory Body Program Committee grant funding from the Australian Government Department of Health, Disability and Aging. And Debbie?
Hi, I'm Debbie Passy. I'm a research fellow and implementation science specialist at the Center for Digital Transformation of Health at the University of Melbourne. And I'm happy to be here with all of you. Oops.
I can go. So a quick overview.
Sorry, go ahead, Carol.
So today we'll provide a very brief project overview and summary for those of us who were not with us at the first webinar in December. And then I'll pass on to Portia and Debbie to go into the findings of the survey. If you have questions, please put them in the chat or the Q&A function, and we are going to do our best to try to have time at the end for questions. So this project, so funding mechanism for preventative health apps, what we are looking at, we would like to develop options and some cost modeling around those options for the public funding for health practitioners in primary care who support and monitor consumers and patients who use preventative health apps. We have found that there's potentially a gap here, the survey tends to confirm that. And so the objective at the end is really to contribute to the conversation on looking at what kind of models we could be looking at and what would be the cost impact of it. To have a broader view of the entire project, please go to this link that's in the chat. It's on the AIDH website. We keep it up to date with every milestone and new deliverable. Next. So just very quickly, there are three broad phases in this project. The first one was dedicated to the desktop research and the evidence scan that we delivered in November, December. Second part, we are just finishing the part around the stakeholder engagement, which include the national survey we are talking about today. And in the last part, until June, it will be around developing the cost modeling. Next. So high-level summary of the findings to set the context for the survey. What we found looking at Australia and overseas, there was no single off-the-shelf pathway that we could just say, yep, that's the way we can fund this work. So there's no one-size-fits-all model, and there are three main ways that the funding could happen. Either through targeted Medicare benefit schedule items, through monthly payments linked to My Medicare, or through national commissioning pathway, or a mix of all of the above. Next. So in the survey that ran from the 2nd of December to the 31st of January and was distributed via type form, there was 54 questions, but it was a little bit of choose your own adventure. So the respondents responded between 24 and 36 questions, depending on their category, with the three main categories in the audience being consumers and consumer advocates, health practitioners, and other professionals working in the health sector. There were three main things we wanted to know from the survey. One, gauge stakeholder sentiment on the appropriateness of introducing funding models for the monitoring of preventative health apps, collect views from on the different aspects of the funding, what matters most in terms of is it about the administrative burden, is it about the fairness, is it about integration in the workflow, etc. And finally, the objective was to collect information for the cost modeling. So these were very specific questions that are going to help in the future phase of the project. And with that, I'll pass on to Debbie and Portia to tell you more about what we found. Thank you very much.
Okay, I guess this is my piece, huh? So before we go into the results, and I'll try to be really brief so that there's some time for questions. I just want to acknowledge that there are limitations to an online survey. So there's response bias. You know, we're getting people who have access to the internet and are sufficiently biased to be interested in this topic, obviously. Generalizability. So, you know, almost all the consumers responding to the survey rated themselves as confident or very confident with digital tools. And then, you know, clinicians that already use digital health tools may be more likely to respond. And then it is an online platform. So people may have skipped questions or maybe had questions about the questions and we weren't able to answer them while they were filling it out. I just want to put those up front that we are aware of these limitations.
And I'll just add a comment there. And by the way, we decided to run this webinar taking a cue from the Winter Olympics. So it's just sort of a little bit of a dividing it up. Debbie will be giving more of a play-by-play, and I'll add some color commentary here and there as we go along. I kind of just want to, I really appreciate Debbie putting this limitations at the top of this survey because we really want to acknowledge that we recognize that basically what this is just a snapshot of this community, really. And the thoughts within this community, within the folks in the precinct who attended the first webinar probably, but also responded to some of our social media posts. And we're not taking it as more than that, but we think it's very informative for what it is. And we thought we still had some pretty interesting things that we learned from it. So we'll go from there.
Perfect. So survey responses were collected December 2nd. We did technically put January 29th as the end date, but we had some additional responses trickle in and we did include those. So for all of you late people, you got in here. So this is a preliminary analysis for 149 responses. We had a question about the capacity in which they were responding. So this is, what is the role that you are responding to the survey? And it was healthcare practitioner, consumer, or other health-related background. And you can see the other health-related background is a bit larger. We had 81 respondents in that category. But then the next question was to ask people about a professional role. So what role were they in professionally? And this is not the same as answering what capacity. And you can see it's a little bit all over the place, but the majority, 24% were healthcare practitioner. Okay, so the initial questions, these were posed to all respondents. So this is 149 responses. What role should healthcare practitioners play in prescribing and monitoring apps? And you can see across the consumers, healthcare practitioner, and other health-related groups, it's pretty similar as far as percentages. So recommending effective apps, about 90%, 85 to 90% responded that yes, that's a role that healthcare practitioners should play. Educating patients was around half of them. Reviewing information was up almost 90%, and then responding to alerts from the apps. Healthcare practitioners responded at 67% in that category compared to consumers and the other health related.
And so I'll just add here, I think, so we didn't add a whole lot of statistics in most of these because things were, fairly easy to just sort of see with your eyeballs. But I thought sometimes when you don't find an effect that's informative and seeing this sort of even response across the different groups was useful to know that there's not like a big gap between folks responding in different capacities. And I also, I just wanted to sort of pull out, recommending effective apps really builds on the work that started, that this grew out of, which has to do with AIDH working on a quality framework for mobile apps. So I just wanted to highlight that as well. And then my final comment on this particular question was that, you've got the first two items are things that would and could and probably would happen in the course of a visit, an in-person or a telehealth visit. And that those last two items are things that could happen in a visit, but also could happen asynchronously. And that's really what we're talking about here when we're talking about developing new funding mechanisms.
Yeah, that's insightful. Next one was there are benefits to tracking health data and allowing my healthcare practitioner to see app data. And so this was the number that agreed. So strongly agree or agree. You can see here consumers, healthcare practitioners, and other health related very highly agree with this. So the consumer specific questions, we had 32 responses. As I said in the limitations, the majority of consumers responding said they felt confident and extremely confident. We only had 3% that said they were not confident and 3% that were neutral.
And so again, this does not reflect, data we have from national surveys about digital literacy and digital health literacy. So this is a pretty skewed group, but this is the group that shows up to a webinar on digital health. So it's not too surprising.
Do you currently use preventative health apps for? So consumers were asked if they were using these apps, and 60% were using them for healthy lifestyle. 19% or 6 of responded chronic disease management. And I broke that down to show you because we asked them to put what chronic disease they were managing. And so these were responses. It was, diabetes, heart, musculoskeletal, sleep apnea, multiple conditions, and rheumatoid arthritis. One was not sure, and then 6 or 18%, sorry, I had to round these percentages, said I don't use any apps. Would you be more likely to use an app if you knew it would send health-related info to your provider? The majority said yes, 87.5%.
And my comment on this one is just that this really kind of underscores our understanding and our kind of theory of change about how the most effective apps really work. And two of those ways that they do tend to work are by improving self-management and sort of confidence that people might have in managing a condition. And then a second really key sort of theory about how these apps have effects on health outcomes is in safety, right? So if someone is managing, heart failure or chronic obstructive pulmonary disease, the purpose of the app is to sort of alert the right clinician at the right time if there could potentially be an exacerbation of their disease and get them care before it becomes really serious or potentially mortal.
Mm-hmm. So health sector professional specific questions. We had 81 responses in this group. What do you think is the best way to pay health practitioners for the monitoring and reviewing of data? 34%. Sorry, I can't see the bottom because of the Zoom Toolbar, I think that's the targeted NBS. Yes, sorry about that. And then monthly payment had about a quarter, and then the national commissioning, and notably 20% don't know enough to provide a response to that. Oh, sorry, let me. For each type of preventative app below, please select which funding mechanism you think would be the best primary way to pay health practitioners time. This chart might look a little messy, but I think the main thing I get from this is that targeted NBS items by measurement type were the most consistent across the different types of monitoring app, decision support apps, or behavior change apps, followed by those monthly payments linked to my Medicare enrollment. And then national commissioning was a little bit lower, and then there were some folks who were not sure. What outcomes do you believe would improve under a funded monitoring model? And patient health outcomes and early detection were the highest, but reduced hospital presentations, better continuity of care, and patient experience were also rated quite high. I think the lowest was clinical workload. So I guess that makes sense that clinical workload, less people thought that would improve.
If anything, probably increase it.
Yeah. And then the last section is the active health practitioner specific questions. We had 36 responses, and this is for people who are actively providing clinical care. What is your primary role? So 56% were general practitioners, and then we had a little bit of everyone else, basically. So a practice nurse, nurse practitioner, pharmacist, and then people could answer other. And within the other, we got kind of a mix of, I think, allied health and palliative care, specialist physician, pediatrician, and social work. In the last year, sorry, the Zoom work bar, approximately how many patients did you support with preventive health apps? 37% said they do not currently support any patients using the apps. Notably, a quarter said 1 to 10, and 28% said 11 to 100. So there is some of this is happening already. Which types of apps? Oh, sorry about that. Which types of preventive health apps do you currently recommend to patients, or do you think would effectively improve care outcomes? I'll leave it on this slide for just a minute because I think this is a nice snapshot that there is quite a variety of apps that are currently that health practitioners thought would be that they recommend or think would be would improve care. So just going around this little pie slice, weight, nutrition, and physical fitness is at 23%, so that's the largest. 19% was other, and within the other, there was just sort of a random assortment of chronic conditions in there. 16% were none, so there are people who are not doing this. Another 16% were for substance use cessation, so like smoking cessation. And then 13% for diabetes, 7% for asthma, and then sleep monitoring and cardiovascular health monitoring were those other little thin slices.
And this is where I sort of want to position ourselves as I think that to our credit, this is an example where we actually took the survey as an opportunity to step back and rethink some of our assumptions. And so for those who were in the first webinar that we gave, you'll know that we really focused some of our evidence scoping and understanding around really secondary prevention and things related to managing chronic conditions. And so asthma, cardiovascular disease, and diabetes were the where we had decided to, for practicality, focus scoping our effectiveness review. Because those are the places where, as an economist, I have to say I'm anticipating that you could see the highest levels of cost effectiveness because those are the sicker populations that are at higher risk of hospitalization. But these answers made us kind of step back a little bit and kind of realize that truly preventative health apps, there's a lot of activity going on in nutrition, weight management, and behavior change and substance use. And so we're kind of might pivot our approach a little bit, and so we might add something related to substance use, tobacco, or behavior change into our final report because of the importance of this category of apps to the primary care community and practitioners.
What percentage of, I'm sorry, the Zoom too, percentage of your patients would be appropriate candidates for preventative health apps? Notably, 43% of active health practitioners responding to the survey said more than 25% of their patients, which I think is a really, really interesting finding. 23% said 0 to 10%, so maybe a smaller piece there. And then 34% were in that kind of 11 to 25%. Oh, sorry. So this is the same question that we had asked the health sector professionals. And so this is the same question for each type of app below. Select which funding mechanism you think would be the best. But this was asked to active practitioners. And so for the monitoring apps and decision support, a majority said targeted MBS items by the measurement type, and then monthly payments. And then for the behavior change, the National Commissioning Program was also pretty highly rated. And then again, there's some uncertainty of some are not sure which would be the best. What level of evidence would you want to see before confidently recommending and supporting a preventative app? Oh, I'm sorry, that cut off that thing. TGA approval was by far the highest. And then there was about a quarter that said RCT evidence. And then you can see an independent rating, 10%, and then clinical guidelines. Are you currently able to claim MBS rebates for time spent on digital health support or monitoring? 42% said they do it on their own time. So this is happening and people are doing this on their own time. There are some that are doing it in person appointments or using telehealth items. And then 22% were not MBS providers. If adequate reimbursement were available, how likely would you be to increase your use of preventative apps? 75% said likely or very likely, which I think, again, is a pretty notable finding. How frequently would patients require non-face-to-face support? So reviewing data collected by the device or entered. And, I think this is also a really interesting finding that 53% said not sure. And then under a monthly reimbursement scheme, what level of payment would be required to support remote monitoring of preventive health apps for patients? So 56% said this would be similar to a consult. We did have some no response. And then 17% said it would be more than a standard consult, and 14% said less than a standard consult. Oh, okay. Now we are to our next steps.
Thank you very much, Debbie and Portia. So the last question really outlines that there is a certain amount of uncertainty around some of the dimensions of the funding model and the cost modeling. So the things that we are going to explore in the next phase of the project around the cost modeling analysis. It also reflects the diversity and the complexity of the app sector. We've got and the diversity and complexity of conditions. Different conditions require different levels of monitoring, and different apps offer or require different time imposed from clinicians. If it's alert-based or has nice ranges, it's going to be different than if the clinician has to go and review the each data. In terms of next step as well, the final step will be to provide a report to the Department of Health, Disability and Aging, and that's expected to happen in June. Again, the project updates are on the link. And we've got one question in the Q&A. So I will read it. As a consumer, I'd be interested to link up what I'm doing in terms of eating, moving, and thinking well, would link with my GP's clinical data. How could we drive greater uptake of health apps to stay healthy? What do we need to think of in relation to consumer financial incentives? Absolutely. So first, I will say that this isn't initial findings from the survey. It's just a snapshot of some of the findings. As I said earlier, 54 questions. There is a lot more, and it will be published in a report around early April, and it will be available on our website. On the question of incentives for consumers, yeah, absolutely. So it's not part of this project, but we have noted in the first report, and we will note it again in the last one, that the consumer financial investment has to be taken in consideration as well. There are many costs related to the use of apps. It can be the app itself. Not all of them are free, especially if there are more advanced features. More likely it's going to be a premium. And of course, the cost of hardware for the smartphone, the tablet, or device when there's also a wearable associated with it. So not part of the scope, but absolutely necessary. And we are at time. So if you have further questions, don't hesitate. There's a link on webpage on AIDH website. If you have questions, please don't hesitate to write to us or to University of Melbourne, and we talk to each other every week. So if you have any question, please don't hesitate to send them. Thank you very